So I'm working on the Slips, Trips, and Falls project with the Ag Center. And that one is really trying to understand not only, the rate and type of injury that fishermen and shrimpers are dealing with, but also the social and cultural factors that come into play with slips, trips, and falls. So for instance, one of our questions is, do you wear a personal flotation device? And, almost everybody tells us, oh no, we don't wear one unless, we're in immediate danger. But, the problem with that is oftentimes when you're faced with that danger, you might not have time to grab one. Or if you fall overboard, late at night while you're going to the bathroom, you don't have, a chance to grab that. And so trying to dig deeper into that. And so why is it that you don't wear that personal flotation device, that PFD? And, what so many people will tell us is it's bulky, it's not comfortable, it's hot. We can't work as fast if we have that life vest on. And so then what we can do is, try to think, really critically about what can we do to change, either the life vest and how it works for shrimpers, and also looking at what are some of the policies surrounding the specific vests that fishermen, are required to have on board. And is there a way to think about, not just, the number one best safety vest out there, but also, what is something that will still save a shrimper's life that they're willing to wear all the time? And so that's just one example of how we're looking at slips, trips, and falls from, that social and cultural level. But also as part of this work, we do photo voice. And so photo voice is basically we give cameras to the shrimpers and we ask them to take photos of their experiences. And so what's really interesting about that is we, not only get to hear what they're telling us, but we're also seeing how sometimes what they may say is a motivator. So, they're working on something dangerous, and so they're going to wear the vest, or they're, up high, versus reality is, some of the photos show the men still not wearing vests when they're in these, precarious positions. And so that's something else that, we then can take the photos back to them. And we're still in the process of doing this. So I can't really report on that yet, but actually taking the photos back and then saying, okay, can you explain this discrepancy of, that you should be wearing it, during this time, but you're still not wearing it. And so hopefully we get some interesting data from that as well. But something else that's really, I think, interesting about this thinking as well is not only looking at maybe, their personal behavioral changes, but also being able to think about the systems change. And so, why, weren't you wearing it at this time? They might start to reveal something that, we haven't focused on in the past in occupational health, which is, sometimes the structures and the systems and, different policies that come into play as well. So one thing that we've observed and that has come out of our interviews is also very basic healthcare needs, both mental and physical healthcare. And so a lot of the shrimpers that we end up working with are, at least in Galveston, are mainly Vietnamese speaking. And many of them came over in the 70s or 80s as refugees. And then in the Rio Grande Valley, we work with a lot of Spanish-speaking immigrants who are here on H-2A visas, which is a work visa for ag workers. And what we've noticed is that for both of these groups, there's a huge lack of access to just basic primary care. And so, there's kind of this Maslow's hierarchy of needs, where if, we come to someone and say, you need to wear a personal flotation device because, it's going to reduce your likelihood of having a fatal injury. I think the shrimpers understand that. They know that. They tell us their work is dangerous.
Sure.
I'm not saying anything new to them. But also, when some of them haven't seen a doctor for a decade or more, don't have transportation, some of them don't have housing, that specific need isn't necessarily what's on their mind. And so, when we went out there asking about, injury and, non-fatal injuries, and, a lot of times they steered the conversation more to, I have, eye issues. I haven't been able to, see a dentist. And that's one thing that I think this project is also going to really highlight and to bring to the forefront is, what we call social determinants of health, or, basically all of the different factors that come in to impact someone's health, and including injury. So that's housing, it's, your work, it's, transportation, where you live, the community that you have. And so all of those factors and how they relate to occupational injury is really important.